A recent poll commissioned by the American Speech-Language Hearing Association, or ASHA, and conducted by ASHA speech-language pathologists indicates a dramatic increase in traumatic brain injuries among the civilian population nationwide. Worse than that, inadequate insurance coverage may be the biggest obstacle to optimal recovery.
Our polls show that 65% of our polled speech-language pathology members see inadequate health insurance or benefits as the largest barrier to optimal recovery. More than 40% of our poll members are seeing a decrease in the amount of insurance coverage for traumatic brain injury-related services.
And for those who already struggle with the consequences of a traumatic brain injury, inadequate insurance coverage adds insult to injury.
How can an insurance company make a determination about what is happening inside my brain that is stopping my life from functioning the way it used to, and they won't pay for the treatment that I need?
Traumatic brain injury, or TBI, is defined as a blow or jolt to the head or a penetrating head injury that disrupts the function of the brain. A TBI can result in short or long-term impairments affecting thinking, language, learning, emotions, behavior, and sensation. TBI is a major problem, especially among certain groups of the civilian population.
A group that's more prone to a traumatic brain injury, logically, would be the more seniors, the senior adults in our communities, people who may sustain a fall, or maybe younger children, could be athletes that are playing football or something more contact sport are at higher risk. But also, too, the people that are, say, riding motorcycles that are not wearing helmets or are just engaging in some high risk, either athletic or physical activity.
Although in great measure therapy helps those who suffer a traumatic brain injury, for many, the consequences can mean lifelong changes and adjustments.
My life has changed a great deal. By and large, coming here most days and getting this training, but I can no longer do the things in which I took for granted before, and that would be things like, sports like baseball or sailing. I can't quite, just go out and do them. I need to kind of prepare a little bit. I can't drive a car. My family life has changed. They've had to adjust to me. People have had to ask hard questions, and I've had to come up with the answers to those hard questions, which have become much easier for me.
To many, the victims of a traumatic brain injury look and act normal, so those who don't know about TBI diminish its importance and dismiss it.
A person is in a wheelchair, we can look and say something serious has happened to that person. If we see somebody who's on crutches and they have a broken bone, we know something has happened. We have a visual connection to the injury. We don't know the details, but we know that that person has had something serious go wrong. You don't know what's happened to me. People look at me and don't really know how to respond to me.
The great unanswered question is how to force health insurance companies to provide adequate coverage for cognitive rehabilitation and other extended care needs for survivors of TBI. To learn more about cognitive rehabilitation, traumatic brain injury, speech-language pathology, and the American Speech-Language Hearing Association, visit www.asha.org.